Yeah, really delighted to be able to speak with everyone. These are disclosures, so none of them really affect the talk that I'm having today. And just to jump in, it was 1817 when James Parkinson's first described the syndrome that we now think of as being typical of the motor changes in Parkinson's disease. So slowness, shaking, and a propulsive gait with stiffness and rigidity. And he examined three people, but he saw three people only on the street and said, oh, that's so characteristic that he wrote this essay on the shaking palsy. And it's relevant because this was 1817, which is the beginning of the Industrial Revolution in the United Kingdom. And it's relevant to our whole question about are environmental factors really related to Parkinson's. More recently, there have been studies of the numbers of cases of people with Parkinson's, so prevalence, the number of people in a population, the number of deaths from Parkinson's, and the number of what's called disability adjusted life years, so the combination of years of life lost and years living with disability. And all of these have been increasing. This is rates from 1990 to 2016 in all the different levels of sociodemographic index countries. Overall is in red. If we look more closely from 2000 to 2019, quick summary, there have been a 100% worldwide increase in deaths, an 81% increase in disability adjusted life years for Parkinson's just in that 19-year window. So definitely it seems like Parkinson's and the burden of Parkinson's is increasing, starting with 1817, moving forward. The World Health Organization has identified particular priorities to address, and one of these is prevention and risk reduction. And the reason I highlight that one, all are important, is because to be able to do that, it's important to understand causes, because then you can really start to address prevention or reducing risk. So that leads to the question of what causes Parkinson's. I came in as a young student when I heard Bill Langston talk about a cluster of young narcotics addicts who had a syndrome that was very similar to Parkinson's. The same signs, people got better with levodopa, they got the same side effects, but they got it within just a very short period of time, within weeks rather than over years. This is the detective work they did where they found this garage where people were making a designer drug that went wrong. It was called MPTP, and it's rare. People are not going to be taking MPTP in our population in general. So itself, it's not a likely clause, but it led us to be thinking this could be similar to chemicals in the environment. And in the laboratory, toxicologic studies in the laboratory found some of the mechanisms of MPTP could cause experimental Parkinsonism. So that led to our interest in trying to understand the environmental causes of Parkinson's. Just about the same time, genetics was improving its ability to identify, to characterize and identify genes and changes in the inherited substance, the DNA. And a family that had been studied for many years, it was from Italy, but also present in North America, was identified to have the very first genetic cause of Parkinsonism. This is now called PARK1, and it was a change in the gene that makes a protein called alpha-synuclein, which many of you have probably heard us talk about. And this is a key component, not just in these few people, but if you look at the brains of people who've died with Parkinson's, alpha-synuclein is present in Lewy bodies, which are typical pathologic changes we see in many, many people with typical Parkinson's disease. So it said, this is a clue. And some people were saying, gee, it must all be genetic, and that environmental stuff really isn't relevant. So putting that all together, the people who were studying the genes, the people who were studying environment, we designed a study to look at that question. And the question was, looking in twins, if identical twins are more likely to both members of the twin pair to have Parkinson's. And that suggests that there's a very strong genetic component. But if the identical twins and the fraternal twins, so MZ is identical, DZ is fraternal, are similar, then it's more consistent with environment and shared environment, which twins have, than shared genes, which identical twins have almost 100% shared genes. So we did this study. We found a whole group of men who had been assembled to study heart disease, who were veterans of World War II. We went out, we examined both twins in a pair, and what we found in the 1990s, when these men were in their 60s and 70s, was that concordance, meaning both twins have disease, was fairly similar in identical and fraternal twins. And when you looked at the twins who were over 50, maybe even more so. If you looked at the twins with very young onset, there was a pretty big genetic component in the identical twins. And then we followed them up 20 years later, we found the same thing, leading to this belief that environment is in fact an important contributor to the cause of Parkinson's. So that said, there still are other genetic causes of Parkinson's. Genes aren't, out of the picture completely. And the more we've been able to study genetics, the more we've been able to understand that some people have what we call primary or Mendelian variants associated with Parkinson's. It's kind of the major cause. But even in those, for most of them, what we call penetrance is reduced, meaning lots of people have that variant, but only a percentage of them actually ever get Parkinson's disease. So most of the time, even having the gene variant doesn't mean you're going to get Parkinson's, and other genes or environmental factors also are associated with it. And then many people have very small variants that have a little tiny effect, so 1%, 2% increased risk of disease. And we'll talk about those again. But for most people, it seems that environment is still an important factor. This is a study that's going on in the US from the Parkinson Foundation. People with Parkinson's are being enrolled globally. I'm not sure if it's in Canada. So far, more than 20,000 people have been tested, and about 13% of them are positive on one of the PD risk genes. So again, a big bunch of people who don't have these primary Parkinson's genes. So that leads us to environment, and I'm going to talk about these different environmental factors that are shown here in this slide: pesticides, solvents, head injury, air pollution, and other things, starting with pesticides. So many people have looked at the question, are people who are using pesticides at greater risk of Parkinson's? This is a summary of many, many studies done up to 2012. And the answer is yes, about 70% increased risk in someone who is exposed to pesticides, usually by their occupation. The problem is pesticide is this huge chemical category. It's very hard to take that and understand anything about what really is happening to cause Parkinson's risk. It's probably not every single one of those pesticides. We were lucky to be able to study a group of farmers and their wives who are being studied for cancer risk, and we could tag on the Parkinson's part and look at their farm records, go out to their farms and examine them, collect samples, and we were able to find that both rotenone and paraquat were associated with a higher risk of Parkinson's, more than a twofold increased risk of Parkinson's in people who used one of those chemicals as a pesticide in their farming activities. And it's interesting because rotenone blocks mitochondrial complex 1, which is what is blocked by that chemical MPTP I told you about, and causes a laboratory form of Parkinsonism, caused Parkinsonism in that group of drug addicts who were inadvertently exposed. Paraquat increases reactive oxygen species and is another mechanism for causing Parkinsonism in the laboratory. So you can take either one of these, look in laboratory models, and cause the same injuries as happen to people with Parkinson's. So very compelling evidence that these are related to human Parkinson's. And we were able to do another study where we looked at people with occupational risk factors for Parkinson's, and we were looking at many things, including pesticide exposure. We found again paraquat, about the same increased risk, and we found another herbicide, 2,4-D, which is also associated with greater risk of Parkinson's, about 2.5-fold increased risk as well. 2,4-D is interesting because in the US military, herbicides were used during the Vietnam era service during Vietnam War, and 2,4-D was one of the components of a number of these herbicide mixtures, leading to the relationship in US military veterans between Agent Orange exposure and Parkinson's disease, so that in the US, some Vietnam veterans are now eligible for disability compensation and healthcare benefits because of that. 2,4-D is interesting because it's been around since 1945 in more than 1,500 products. And importantly, it's environmentally persistent. So it sticks around in the water, the soil, the oceans. In Vietnam era in the US, it was used in a number of different herbicide mixtures with a greater increased risk, but it's still used in lawns and golf courses and farms. These are some of the brand names. It's used in Roundup in addition, along with 2,4-D is called Enlist Duo. So all of these things are still being used. And I don't have it in the slide, but there was just a recent paper that was published showing living near to golf courses also increasing risk of Parkinson's, possibly related to some of these findings. There are many pesticides that people have found associated with Parkinson's worldwide. This is just a really long list of all the things that at least one study has found to be associated with Parkinson's. Some of them are in big classes like organochlorines or organophosphates, and that's important. These are environmentally persistent, so they can stick around for a very long time. This shows the green shows pesticide use per hectare of cropland in 1990. Darker is more, right? So North America, fairly significant. China, really a lot. South America, fairly significant. And then the purple is disability adjusted life years by Parkinson's. And the orange is deaths due to Parkinson's. And as you can see, the dark areas are kind of similar. Again, this is just, what we call ecological. So it doesn't prove anything, but it suggests that paying attention to pesticides in the environment is important when thinking about preventing Parkinson's. This shows the use of pesticides per hectare cropland from 1990 to 2019. And the point I want to make here is that nothing's going down. Best case is it's sort of staying constant. Some places like South America, it's increasing dramatically. So far at least, we're not doing a very good job. Next comment of what causes Parkinson's are solvents. And I'll talk about a number of different solvents. So the first observation here was by a neurologist in Kentucky, Don Gash, who was taking care of people with Parkinson's in his clinic, and he noticed just kind of coincidentally, 3 of them all worked in the same small industrial plant, and he went to investigate it and found that they all were working kind of in the same job area where they were exposed to vapor degreasing vats that contained trichloroethylene. And he examined the other people who were working there and then people who were working in other parts of the plant. And he found people who were working in that area exposed to TCE had sort of mild symptoms that could be early Parkinson's. It wasn't diagnostic. And the other people in the other parts of the plant did not. That led us to be interested in going back to our male twin pairs where one twin had Parkinson's and the other did not. And we collected lifetime histories of the jobs they did and what exposures they had. These were rated by someone who is an industrial hygienist, so an expert in knowing what things you might be exposed to if you're doing certain jobs and tasks. And she rated these, not knowing whether it was a Parkinson's person or not, just saying if you had that job, you were likely to be exposed to one of these chemicals, and she rated for a number of things, including trichloroethylene and perchloroethylene, and found that people exposed to TCE, trichloroethylene, had a 6-fold increased risk, and perchloroethylene a 10-fold increased risk of Parkinson's in those pairs of twins where one had Parkinson's and one did not. So solvent exposure seemed to be really associated with Parkinson's. Then a group of individuals were identified by Ray Dorsey and a number of others of us who were individual people with Parkinson's who agreed to be actually identified by name. One of them is Brian Grant, the famous basketball player who got Parkinson's at an early age. And he, interestingly, was a young man on Marine Base Camp Lejeune in North Carolina, where his father was in service, when the water was contaminated with trichloroethylene and perc. From 1953 to 1987, it was way greater than the expected level that was thought to be safe. And it was persistent for a very, very long time. So he was exposed as a young man to trichloroethylene. And maybe or maybe not, we can't prove it for sure, that has something to do with the young age at onset Parkinson's that he developed. We were able to look at Marines who served at Camp Lejeune and compare them to Marines who served at the same time, but were stationed in Southern California at Camp Pendleton, where the water was not contaminated. We were able to determine Parkinson's disease in these men who were still pretty young in their 50s, so sort of a younger age for Parkinson's, and found about a 70% increased risk of Parkinson's in the men who were stationed at Camp Lejeune, again, possibly related to the contaminated water supplies there. I think most people are familiar with the concept of prodromal Parkinson's, the idea that other things like sleep disorders, depression, constipation, anxiety, loss of sense of smell precede Parkinson's disease. And we were able to look in the same population and find that loss of sense of smell, anxiety, and depression were also higher in the men who were stationed at Camp Lejeune with the contaminated water compared to Camp Pendleton, even if they didn't have Parkinson's. So this is possible prodromal Parkinson's. We also applied a risk score that's been developed for people who may be at risk of developing Parkinson's and found the prodromal risk score to be higher in people who were stationed at Camp Lejeune compared to Camp Pendleton, again, suggesting there's an association between the contaminated water and Parkinson's or prodromal Parkinson's. We finally looked at the men who actually had Parkinson's, who had been at Camp Lejeune, and looked at their exposures. And we were able to look at some of the progression milestones, meaning more rapid progression in the people with Parkinson's. And we saw that people who had higher exposures to contaminated water at Camp Lejeune were more likely, this is the red line, so this is time over days from the time of diagnosis. This is 5,000 days here. And you can see a much steeper curve. So people were more likely to have falls or fractures or to develop a drug-induced psychosis if they were exposed to trichloroethylene at that time. So why does TCE matter? First, it's used as a solvent commonly since the 1920s. In the US, millions of pounds are used annually. There are many, many past uses that are no longer used, like for anesthesia, medical anesthesia, to get caffeine out of coffee, a very common dry cleaning solvent. And importantly, it's environmentally persistent. So all these little maps over here are showing plumes of trichloroethylene in water supplies under Dayton, Ohio, Brooklyn, New York, Mountain View, California, Tucson, Arizona, Minneapolis, Minnesota, many, many places all around the US, and possibly the same may be true in Canada. So it's in about 33% of US water supplies. It's not really well monitored. And importantly, it's what's called a volatile organic compound, which means the water can evaporate, the TCE can evaporate out of the water, and then concentrate in homes and offices. So it's in the water, a house is built over the soil and water where it is, and it concentrates in that building. So you may not even have any awareness that there is such a thing. And here's an example that we published a couple of years ago of a cluster of attorneys who were working in a law office next to a contaminated site where a dry cleaner had been working, and they contaminated the ground and the water supply with trichloroethylene. That then evaporated and concentrated in the building where the attorneys were working. And it was only when someone kind of said, wait, let's measure the air in here and see what's going on, that they realized that they had 25% of the attorneys had a neurologic disorder, 5 Parkinson's, and one with Parkinson's-like syndrome, multiple system atrophy, or a cancer associated with trichloroethylene. So a very large number of people had some health effect from this concentration of vapor in the building next to which they were working. And this is just showing worldwide sites where there have been reports of contaminated groundwater. It's not saying how much in any one place, but look at the map and you can see it hasn't been measured everywhere, but pretty much if it was looked for, it was found. So an extremely common contaminant increases risk of Parkinson's, increases risk of prodromal Parkinson's, and also leads to more rapid progression in people with Parkinson's and prior exposure to trichloroethylene. So something, again, we should be paying attention to. Head injury. Oh, wait, maybe it's time for a break, right? Yeah, exactly. Let's take a break and then we'll talk about head injury. Does that sound good, Kelly? You there?
Yes, this sounds perfect. Thank you, Dr. Tanner.
Good.
And now it's time for our movement breaks. I would like to welcome Sarah Madian.
Hi everyone. Glad to be here. Um, I'm just gonna do a little mindfulness for you guys to practice during this break. We're gonna sort of use our imagination today to try to recreate, maybe create a new safe place that we can go to when we're feeling overwhelmed or just at any moment. So I'll guide you through one. Feel free to get as comfortable as possible as long as you can hear me. And if it's comfortable for you, it can be easier to imagine things if you close your eyes. If not, you can keep them open with a soft gaze. Yeah, let's begin by taking a deep breath in and just settle in to your body. Just staying with the breath for a little bit. Noticing yourself breathing. And if you notice your mind wandering, it's okay. Just gently bring your attention back to your breath. Sing as you breathe in. That's like, and as you breathe out. As you continue to breathe, I want you to think of a place that you find comforting. This can be a place that you have in your memory, a place you've been, a place you've seen in the movies or online. This is a safe, comforting place. It could be a secluded beach, bedroom, quiet mountaintop, or even a loud concert. For the next few moments, I want you to try to imagine this place in as much detail as possible. As you recreate this comfortable, safe space, see if you can expand your awareness, noticing what's around you. This comfortable, safe space that you're creating in your head. Seeing if you can look around, noticing the small details. Seeing what the ground feels like. If there's anything in the distance. Seeing if you can now gently tune into the sounds that you would hear in this comfortable, safe space. And if your mind wanders, that's okay. Just gently bring your attention back to imagining a safe, comfortable space in as much detail as possible. As you continue to recreate it, seeing if you can tune into your senses of touch in the safe, comfortable space. What can you feel? What's the temperature like? Reflecting on how the air feels on your skin, how your clothes feel on your body. Trying to soak in all of these sensations. Seeing if you can tune into your sense of taste. Reflecting on if you're would be drinking or eating something enjoyable in this comfortable space you're creating. The flavors like. How does it taste? And finally, tuning into your sense of smell. Taking a deep breath in this imaginary space. Noticing what scents are present. They're strong or faint. Noticing what the air smells like. Now bringing all of these senses together. Soon we're going to allow this image to dissolve. Before we do, just take a moment to take a deep breath in. Thank you all so much. I hope you enjoyed that little uh, break. And thank you, Kelly, for letting me join. And then I'll let you guys all get back. Thank you.
Thank you very much, Sarah. And now I would like to pass it on to Dr. Tanner.
Okay. Let's see. All right, can you see that?
Yes, that's good.
Okay, great. Okay, so one of the other things that's associated with Parkinson's risk is head injury. We'll just talk on that very lightly, but again, looking in the veteran twins, this is one place where it's been seen. It's been seen in many other populations. We found about a 2.5-fold increased risk with one head injury, but more than one head injury progressively increased the risk. So about double that or 5-fold increased risk with two head injuries, for example. And it was similar in MZ-DZ twins, so, another environmental factor. And then there are probably other chemical exposures that may be related to Parkinson's risk as well. I'll just touch on one that we've been investigating. This is another set of persistent environmental pollutants, and we were studying it particularly in Alaska Native people because of the way that these can bioconcentrate in Arctic regions. So again, for Canadians, this may be something somewhat relevant as well. And what we found is that people who had higher blood levels of persistent organic pollutants, like the polychlorinated biphenyls, DDE, which is a DDT metabolite, hexachlorobenzene, which is an organochlorine pesticide, had a greater risk of Parkinson's compared to people who did not have high levels of these chemicals. So these are because of exposure in the environment that's been around for a long time, what we call persistent pollutants. And then the last environmental pollutant that people are starting to be able to look at is air pollution. And in many different studies, I'm just showing two of them here, it's been observed that fine particulate matter that is part of air pollution is associated with a greater risk of Parkinson's. This is one looking across the US at people who receive Medicare, and this is one looking in Olmsted County, Minnesota, where they've been tracking Parkinson's for many, many decades. And in each case, the greater the exposure to the persistent pollutants, the greater the risk of Parkinson's disease. So this is a map we made a while ago of the incidence of Parkinson's across the US in North America. And so this is looking at The darker purple areas are where there's more Parkinson's, and the greener areas where there's less, and it's adjusted for the population density. It suggests that there are differences, and while we don't know, it's possible that this could be in part at least related to differences in pollutants in the environment. And many of these are areas where there's a lot of agriculture, a lot of possible pesticide exposure, some industrial areas or metropolitan areas where there is a lot of air pollution as well. So certainly a question is raised about whether or not environmental exposures increase Parkinson's risk. There's a lot of evidence suggesting that, but of course, we don't expose people to things on purpose to see if it's really causing it. So we can only kind of make assumptions based on these studies that we've been doing in human populations. And then importantly, lots of people have these exposures, but not everybody gets Parkinson's, obviously. So we think that really it's the combination of one or more exposures and your genetic makeup that leads to Parkinson's risk. So the idea being genetics loads the gun, with that being like the DNA strand, and environment pulls the trigger. So for most people, it's going to be both genetics and environment. This is just one example, looking again in the farmers in the agricultural health study, and looking at one of the genes that makes an enzyme that detoxifies, that breaks down things that you might be exposed to from the environment. This one breaks down paraquat. And what we found is that if you have exposure to paraquat and you have a not functional GSTT1, so you don't make that particular enzyme in your body because of a genetic characteristic, that your risk of Parkinson's is about 11-fold increased. If it's only paraquat, it's about 2.5-fold. And if it's only just the inactive version of that glutathione S transferase, it's only about a 70-fold, 70% increased risk, or 0.7. So similarly, we found that people who have head injury and paraquat use have a higher risk. So two different environmental exposures also seems to increase risk, this time about 4-fold instead of 2-fold. So it looks like for most people, this is kind of what we think is causing Parkinson's, with a few people having just one gene, a few people just one environmental exposure, but most people it's a combination of multiple genes, multiple environmental exposures, or a really complex combination of many different factors that combine together to cause Parkinson's. And then I just want to point out there's another set of environmental factors that are important because they lower disease risk: physical activity, healthy diet, probably coffee and tea intake, not recommending it, but possibly tobacco use and certain drugs may also lower Parkinson's risk, leading to the whole idea of maybe being able to prevent Parkinson's. So this is an example of healthy diet in the agricultural health study, and the farmers who were exposed to paraquat but also had a healthy diet, their risk wasn't really significantly increased. But farmers who had an unhealthy diet, really high in animal fat, a lot of processed foods, had more than a 4-fold increased risk if they used paraquat. And then just another very sort of self-evident thing, if farmers used protective equipment when they applied paraquat, they were not at increased risk of disease, even if they were mixing and applying paraquat. So two things that suggest you can be exposed, but it can be prevented. Secondary prevention means stopping the progression of the disease once it's started, so keeping it from going forward once the disease process has started. So that would mean identifying people maybe in this prodromal phase with loss of sense of smell or REM sleep behavior disorder, and trying to stop them from progressing to Parkinson's onset. And we've been doing this in a study called the Parkinson's Progression Markers Initiative. We test people for loss of sense of smell who don't have Parkinson's, and then study them for dopamine transporter deficits. And then we look at their spinal fluid and find the abnormal alpha-synuclein in their spinal fluid. So you can start with a really simple smell test, and study people to identify people who may be in that very earliest stage of prodromal Parkinson's. And what we hope to do next is to be able to start clinical trials in people who have early features or who have the alpha-synuclein biomarker, but who don't have symptoms of Parkinson's, and be able to identify drugs that will prevent disease. And this is just an example of how hopeful we can be about the possibility of doing that. DMT means disease modifying therapies, and all of those letters and words there are different drugs that are being tested as possibly being disease modifying therapies for Parkinson's. ST, symptomatic therapy, are all the new symptomatic therapies that are being tested. So we're really very hopeful that all of these will lead to great steps forward, and we'll be able to do better jobs treating people who have disease, preventing progression, and maybe even preventing disease. So with that, I'd just like to stop and thank everyone who's been a volunteer in our research studies, my colleagues, the families and friends of people in research studies who enable them. And I think we have a few minutes left for questions.